there is something called the rule of nines, where basically they assign each part of the body a percentage that equals the total surface area of the skin. Okay, and the goal of this is to identify the percentage of surface area of the skin affected in burns. Okay, and the more area involved, there is increased morbidity and mortality. So, for example, we can start with the anterior and posterior part of the head and neck. This equals 9%. And then the anterior and posterior part of the upper limbs, so the arms, the forearms, and the hands, this area here, anteriorly and posteriorly, equals 18%. And then we have the entire trunk, anteriorly and posteriorly, equals 36%. And then we have the lower limbs, so the thigh, the leg, and the feet, again, anteriorly and posteriorly, equals 36%. And altogether, that gives you 100%. Okay, so the more area involved that's affected in burn, for example, the greater the chance of morbidity and mortality. Morbidity means disease or a bad outcome, and mortality means death. And then if you want to estimate for a specific part, so if you know the entire thing is 18%, for example, in the arms, anteriorly and posteriorly, you just divide by 2. So you know this part here is 4.5%. But if you memorize the total for each one, the other small numbers, you can just divide by 2 to get that value that you want. Which surface, anterior or posterior? Okay, let's talk about the subcutaneous tissue. So last time we talked about the skin, which consisted of the epidermis and the dermis. Now we're going to talk about the subcutaneous tissue, which is the layer that's right underneath the dermis. The subcutaneous tissue, as you can see, it has fat. So every person has some degree of fat, of course, but the more obese a person is, or the more fat he is, the thicker this layer will be. The thicker the subcutaneous tissue layer will be, or the superficial fascia. So thickness depends on a person's nutritional state or how much fat he has. And then underneath the subcutaneous tissue or the superficial fascia, we have a dense layer called the deep fascia. So both of these are connective tissue. The superficial fascia and the deep fascia, they are both connective tissue, but this one is loose because look how wide it is. This one is dense because you have almost the same amount of material, but it's condensed in a smaller volume. So loose connective tissue, and the deep fascia is dense connective tissue. And also in the superficial fascia, we have sweat glands. And we will talk more about it in the upcoming slide. Okay, so like I said, the subcutaneous tissue, or the hypodermis, or the superficial fascia, they all mean the same thing. It's located between the dermis and the deep fascia. It consists of loose connective tissue and fat. It also contains sweat glands, like I just showed. And most of the fat storage, and most of fat storage is here. So thickness of this layer varies with nutritional state. That means the more a person is obese, the thicker this layer will be, because this is where fat is stored. Okay, let's talk about the functions of the superficial fascia. It retains heat, so it blocks heat loss. It allows you to keep the heat to warm your body, and it protects the skin from the bone. So if we go back to the picture, here we have, here we have the skin. Then we have this layer, the subcutaneous tissue or the superficial fascia. It retains heat and it protects the skin from the bone. So it acts as padding, basically. So it protects the skin from the bone, like I just mentioned. Okay, so the deep fascia, it's right beneath the skin and the superficial fascia. It's underneath the superficial fascia or the hypodermis or the subcutaneous tissue. And it's a dense connective tissue layer with no fat that covers most of the body. So like I said before, this right here is the deep fascia, and it's made up of dense connective tissue, and underneath it is the muscle and then the bone. Okay, let's talk about extensions of the deep fascia. So these are membranes or connective tissue that extend from the deep fascia. They are continuous with the deep fascia, and we have two. One is the intermuscular septa, which divide the limbs into compartments. For example, here here we have a leg. We have a cross section, an axial section of the leg. So we're looking like this. Imagine you're looking from above. This is what you see here. Okay. This right here with the blue color is the intermuscular septa. It divides the leg into compartments. For example, here in the leg, we have an anterior compartment, a lateral compartment, and a posterior compartment. And what's separating it is this extension of the deep fascia called the intermuscular septa. Okay, and then we also have, which is also an extension of the deep fascia, something called the investing fascia. Okay, the investing fascia is basically this right here. It covers the muscle surfaces. So this right here is an individual muscle. This right here is an individual muscle. This right here is an individual muscle. And this right here is also an individual muscle. So this tissue that's separating these individual muscles in the compartments is the investing fascia. Another extension of the deep fascia is something called the retinaculum, which holds the tendons in place. So here you would have tendons coming like this underneath the retinaculum. Okay. And then you'd have a muscle here, of course, that contracts. And then when it contracts, the tendons move. And so you can move your fingers. And another example is this right here. This is a retinaculum. This is a retinaculum. And these are the tendons. The tendons pass underneath. And basically, the retinaculum just holds the tendons in place. That's the function of it. Okay, now let's talk about what is a cavity. Cavity is a space. It's a space in the body. It houses and protects different organs. Okay, let's talk about the different cavities that are present. So first we have the dorsal cavity. Dorsal also means posterior. So we have the dorsal cavity, we have the cranial cavity, which houses the brain. And we also have the spinal cavity, which houses the spinal cord. And then in the ventral cavities, we have the abdominopelvic cavity. So this right here is the abdominopelvic cavity. They're continuous, there's no separation. And then we also have the thoracic cavity, which houses the lungs and the heart. Right here, the thoracic cavity is separated right here from the abdominal cavity, or the abdominopelvic cavity, by something called the diaphragm. The diaphragm is a muscle right here that separates these two cavities, the thoracic and the abdominopelvic, and it's an important structure for breathing. And we'll talk about it later in the musculoskeletal lectures. Okay, we also have, let's talk more about the thoracic cavity. So the empty space, let's say here, let's say this is the thoracic wall. And inside you have the lungs and the heart and all these structures here, the trachea, which is the airway or the windpipe, and the lungs. If you remove all these things in the heart, if you remove all these things, you're left with the thoracic cavity. Okay? However, when you add the lung and you add the second lung, you get another space. You get another space here called the pleural cavity. Okay, and the pleural cavity is lined by a membrane, a serous membrane called the pleural membrane or the pleura. It means the same thing, pleura or the pleural membrane. We have, and it's two layers. We have visceral. The visceral covers the lungs. So like this, it covers the lungs. And then it lines the thoracic wall. When it lines the thoracic wall, we call this layer the parietal. And it's continuous. So it goes around like this, and then it comes back like this. The two layers are continuous. I think the drawing isn't good, but here you can appreciate it better in the diagram. You can see that the two layers are continuous. The parietal and the visceral layers of the pleural membrane, they're continuous. So the visceral pleura is the one that covers the lung itself, and then the parietal pleura lines the thoracic cavity. Let's talk about some smaller cavities. We have the orbital cavity, which houses the eyeball. So right here, you have the eyeball in the orbital cavity. And then you have the nasal cavity here, which is basically your nose, your airway. It's part of the respiratory system. And then you have your oral cavity. Right here, it's very small. Right here, this is the tongue, by the way. So right above it is the oral cavity. Then we have the middle ear cavity. Here you have your outer ear, and this is your inner ear. And in the middle, we have the middle ear cavity. It's air-filled. And we have the synovial cavity, which is basically just a joint cavity. So here you have a joint, and the space inside is called the synovial cavity. Okay, so what's the difference between mucous versus serous membranes? I talked about it in the last lecture a little bit. I mentioned it. So they're both epithelial membranes. However, the mucous membrane lines cavities that open to the exterior, like the gastrointestinal and respiratory tract, and they produce mucus secretion. So what's an example of mucous membranes? You have like the oral cavity. It's lined by mucous membranes. The nasal cavity is also lined by the mucous membranes. Okay, and let's talk about serous membranes. They line cavities that are not open to the exterior, like the pleura and the pericardium, or the pleural membrane, or the pericardial membrane. It's the same thing. When you say pleura, it means pleural membrane, or when you say pericardium, it means the pericardial membrane. But usually for the pericardium, they just call it pericardium. Okay. And the serous membranes, they produce serous secretions that are watery in nature. Okay, so like we said, the serous membranes, they include the pleura, which we see in earlier, that the membranes that cover the lung and line the thoracic cavity, the visceral and parietal layer. And we also have the pericardium, and again, we have a visceral and a parietal layer. When we say visceral, it's the layer that actually covers the heart, that's in contact with the heart. And then parietal is the one that lines the cavity itself. So if we go back to this earlier picture, right here. So here we have the heart. So the pericardium, the parietal layer, would be like right here. Okay. And then, for example, the visceral layer would be touching the heart itself, like this. Okay. So, and the heart obviously, it's in the pericardial cavity. Okay, so let's talk more about mucous membranes. Like I said, it lines cavities that are open to the exterior, like the oral cavity, like the esophagus, like the stomach, like the trachea, the windpipe, which is continuous or not continuous. It's part of the respiratory system, like the nasal cavity. So all these are lined by mucous membranes because they communicate with the outside. unlike the pericardium and unlike the pleura, which they have no connection to the outside world. So we call them serous membranes. These are serous membranes, and these structures here, they're lined by mucous membranes because they are open to the exterior or the external environment. And I think this is the last slide.